This is Trish Miller and Jack Jacobson from the Family Resource Center. Trish started working in the therapy at preschool, got her master's, was the primary therapist for the preschool, now does PCIT therapy at the Family Resource Center. Now Jack is currently the primary therapist at the Family Resource Center therapy preschool. I've worked with them very closely with my little guy Isaiah. He's currently in the preschool there, and we did PCIT with Trish, so I'm really excited about the presentation today, and I think it's very relevant to what we do. So let's give them your attention.
Thank you. I talk pretty softly. This room kind of echoes though, so if you can't hear me, just say, I can't hear you, talk louder. I'll try to wait on. So the name of our presentation today is Nonviolent De-Escalation Strategies for Children in Crisis. And by nonviolent, we really mean non-physical. And so later in the presentation, we'll really be giving you some interventions and tools to use for children who might be acting out or in a stressful situation. Do you guys see that in your work? The crisis nursery? You see acting out children? Okay. So let's see. Some of the things we're going to talk about today, we're going to briefly give some definitions and examples of children in crisis. We're going to briefly go over child development from birth to 12. I believe, do you guys see kids over 12 or no? Okay, so 12 is, but you do see infants too.
Yeah.
Okay, so we're not going to hit too much on it. We're not going to go into detail in terms of development, but then we are going to introduce the crisis development model that we have borrowed from another intervention tool, and hopefully show you how it applies to children in crisis and how you can use some of the interventions to help calm kids down, de-escalate them. And then we're going to give you some strategies for identifying children in crisis and how to appropriately intervene. So I guess first, we'd like to get an idea of what your roles are here at the Crisis Nursery. So if some of you could kind of raise your hand and let us know kind of what you do here, what your interaction is with children, just so we kind of have an idea. Anybody? Yes.
Some of us do home visits. So I'll let somebody else talk about the actual in the nursery, but there are several of us that do home visits, crisis management, problem solving, goal setting. Some of us do also work with the parenting skills, definitely, and some of us do work with helping them understand their children's development.
Okay, and how are families typically referred to you? You do?
Some have used the nursery for respite care. We're getting more and more all the time referrals from people who are already in the program. Sometimes we get referrals from the various children's hospitals or DFS or even agencies like yourself.
Yes, which I believe we have referred to you quite often. Anybody else? What do other people do at the crisis nursery? No intake counseling.
We just take care of the basic needs of kids.
Okay.
It's everyday stuff like making breakfast to reading books, playing games. There's a lot more of a therapeutic aspect also, like when the kids have experienced some sort of trauma that's brought them into the nursery. Mostly counselors will work with them and help them identify, kind of how to process what's going on. And in addition to that, we're also providing parents with resources and referrals to kind of help correct whatever situation might have brought them in, and just be a constant support for the family on both the kid side and the parent side.
Okay. So most of you are kind of like direct line staff who work directly with the children for as long as they're with you. And how long do they typically stay?
24 to 48 hours, depending.
And do they ever go over 48 hours? Or
Yes.
just? Okay.
Do you see a lot of repeat visitors?
Yes.
Okay. Well, and a lot of what we're going to talk about today has to do with children who've experienced some kind of crisis in their life, sexual abuse, physical abuse. And most of the time, those are the children that have problems controlling their own emotions and behavior. And so that's why it's important that we intervene with them.
Is there anything, let's ask them about anything they'd like specifically for us to is there anything that you guys would like for us to specifically address while we're here today that we can try to do? We can try to address. Hopefully we're prepared.
De-escalating children with unsafe behaviors.
With unsafe behaviors. Okay.
Physically violent towards staff, other children,
Okay.
Risk of harm to self.
Okay. I think that the model that we're going to be talking about deals to a degree with that. So that's really what we're talking about. We're also going to talk about a lot of the stuff leading behaviors and anxiety leading up to that. But okay, good. Do you guys do restraints? Which we're obviously not training you guys today, but you do. What model of restraint are you trained in?
Basketball. Basketball.
Basketball. Do you know what?
I think it's adapted from like the CPI model.
It's the CPI. Okay, that's what I was asking. So there's actually some portions of this that are going to look really familiar, but we've made it our own. So.
But our goal is to not do any of that.
No, yeah.
And
I understand
actually, in the last year, we've done one between all 5 of our districts.
Wow.
So it's really not what we do.
Okay, good.
Very proud of that.
Yeah, no, that's awesome.
Well, that's really the goal. I mean, restraint is always a last resort. If the child's behavior is very dangerous and very destructive. And so today, hopefully, you'll learn a lot of strategies for what to do before you ever get to that point.
That's exactly the goal.
Okay, all right. Anybody else have anything different that you hope to get out of today's presentation?
Maybe something like along the lines of referrals. Like a lot of the parents that we're supporting, they'll tell us that children might exhibit these behaviors in the house or in the community, but then when they're with us, a lot of times we don't see that.
Right.
So I don't know if there's, like, we do our own counseling services, but I don't know if there were other agencies out there who might be able to train the parents, like in the same stuff that we're going to learn from you guys today. Like if there's like a parenting support group or something out there, because I can think of a couple parents in particular who would really benefit from something like that.
Absolutely.
Well, and we brought some brochures just from our agency. We have like a Parents Anonymous support group. We do a lot of different services. I right now work for a grant-funded program, and I help using parent-child interaction therapy, but I work with parents who specifically are struggling to manage their children's behavior. So, we have some brochures down for you guys on the way out.
Well, another topic I'd like to hear you talk about is recognizing or being better able to identify the triggers that will lead to escalation, to avoid getting into the situation where you have to de-escalate a child in the first place.
Yes. Hopefully we will talk about that yet. And also your own triggers.
Yeah.
We're going to spend a little
Sure.
bit of time talking about, because you have to know yourself really well and know kind of what sets you off.
And we'll do our best to address that, and that's definitely built into the presentation. That can be really, really tricky.
Yes.
Because a lot of times you just never know what it is
Right.
that it's just like with a Vietnam vet who's returning home, or a Gulf Coast vet, whatever, Gulf Coast, but you know what I mean, who smells diesel fuel, and that's a trigger for his trauma.
Sure.
We just so many times might never know what's going to happen beforehand, but also might never even know what did set it off.
But sometimes we can see some
even 2 hours
nonverbal
later.
signs that a person is
Right.
getting anxious and it's coming
Right.
if they don't intervene.
Yeah. We'll try to address that.
Sorry, you.
Yeah, I'm also interested in I don't know if the model or the techniques would be any different for us working in the nursery versus what the parents might do at home. If there are suggestions that would be appropriate for us to give the parents so that when those same kinds of behaviors, we have to deal with them, but we want to help them deal with it after they take the children home.
I think pretty much most of what we talk about can definitely be used, parents can use, can definitely be taught to parents. And I think in my work, I teach a lot of parents the same things we talk about today. So absolutely. Anything else you want to add?
If we don't answer any of your questions and we miss it, please remind us and we'll bring our attention to that.
Okay, so how do you know when a child is in crisis? A few things up there, but I wanted to ask you guys, how do you know when a child is in crisis? What happens?